Our guest tonight has been on the forefront for people of the Bronx long before she was appointed to public office. She's a strong advocate for higher and better quality education, healthcare reform programs for our seniors and youth, among many more. As a state legislator, she's dedicated to serving the Bronx, especially the residents of the 77th Assembly District. Here now to share her perspective with us tonight as our first guest of 2010, Assemblywoman Vanessa Gibson. And thank you for coming and sharing with us.
Thank you.
Kind of historic first guest into 2010.
I'm looking forward to it. I'm glad.
I'm glad to have you. Glad to have you.
Definitely.
Let's share a little bit. You were elected last year, and obviously,
Yes.
and you're a fresh woman, assemblywoman, however you want to call it. Talk to us about what the experience has been like.
Well, when I was elected on Tuesday, June 2nd, I was sworn in the following day, which was still the legislative session from 2009. And so I had about a little over 2 weeks to serve out the remainder of the session. And so much of that required my presence in Albany, and I traveled each week, and we had a lot of issues and legislative items that we had to deal with. One of the big topics that we had to decide upon was the mayoral control, the school governance legislation, which we were able to pass on the last day of session. So it was a little bit overwhelming, a challenge for me, because most often I was the staff member. And so being a member now, making those big decisions, it was a learning experience and an adjustment for me during that last 3 weeks of June.
Talk about being that staff member, because you were working with your predecessor, Aurelia
Right.
Green,
Right.
and we know where she is. And so now talk about how the transition has been for you.
The transition has been very good. I was very fortunate to have worked as her legislative aide starting in Albany, and I came to the district office to serve as her office manager. And it was a little challenging because I was the youngest staff member, but yet the office manager. And so I learned a lot about the character of the district and the demographics and some of the issues and priorities of concern in the community. And the transition has been very good. I was very fortunate to have worked with a lot of our not-for-profits, a lot of our schools, a lot of our small businesses, our elected officials, community boards, and many of the issues I was very familiar with. And so transitioning during that time, I was able to still carry that same priority in the spirit of making sure that the working families and education and healthcare were main issues of concern that I carried forward. So it was very good.
How do you feel that you're going to be able to carry out your niche? Because I know you've come from under your predecessor. Now you're on your own, so to speak.
Right.
How are you going to be able to carry out your niche?
I think it's with the same energy that I had as a staff member, as the office manager, making sure that residents saw me in the district at community meetings, knowing that I was on their side. So if they could come to my office or I saw them at meetings in the community, knowing that I was their advocate, having a level of compassion and really understanding, knowing that many of the struggles, I have the same struggles too. The same challenges that our families are facing are really shared in my belief. And I think in that spirit of, being energetic and carrying that same message across, and at the same time building my platform in the House, building seniority. As you said, a fresh woman, I don't have any of the seniority that Aurelia Green had, but I do have a lot of energy. I have a lot of ideas and a vision for carrying the district moving forward into this new millennium.
And I know you were working specifically in the area of health cuts and getting that $1.3 million restored in the area of health cuts.
Right.
Talk about your efforts there and the importance of really seeing that legislation through.
Right. Well, earlier this year, I think in late October, November, the governor came before the legislature and announced that New York State had a huge fiscal crisis and wanted us to cut the budget $3.2 billion. And what many residents don't know is in New York State's budget, 55% of the budget goes to education and healthcare. And so when you talk about cuts, drastic cuts that need to make a significant impact, education and healthcare are the two issues and the two projects that are really, really targeted. And so it was my first budget deficit reduction plan that I had to deal with, but It was on the notion that knowing that we had to make cuts, but also understanding and sympathizing with my hospitals and my nursing homes and my rehab centers and my school districts, knowing that any cut, whether it's $1 million, whether it's 100,000, would affect the classrooms, would affect the direct services of seniors. And so I fought very hard in my house with my fellow colleagues to make sure that the cuts were as minimal as possible to the healthcare industry so that hospitals would not close, layoffs would not happen at the magnitude that we anticipated that it would, to make sure that people were still able to keep their job and still able to function and live and carry out the services in the healthcare industry.
And I know a lot of concern, as always, with the Assembly in regards to an on-time budget, being able to, given the fact of the fiscal crisis and the fiscal state of New York State right now, where do we see the budget process going, and how long before will we see an on-time budget?
I think so. I think we will see
Being
an on-time
optimistic, I
budget,
think.
being very optimistic, but knowing that we're going into this legislative session this year with a lot of challenges from 2009, knowing that we do not have enough revenue that is generated and has been generating in the past few months in the state, trying to find ways to bring and create new jobs and bring more revenue, not at the expense of cutting existing programs. Very difficult. We're going to have to make some extremely, extremely hard choices. And education and healthcare will always be at the top because it's the bulk of the budget that we pass every year. So I do hope and anticipate that we will have an on-time budget, but it's going to be with a lot of difficult choices that need to be made, both in my house and in the Senate as well.
But admittedly, I think that's what critics think, because when you look at the fact that, okay, when there was a surplus, the budget couldn't even be met then. Now, given the fact of, you talk about deficit, the governor talking about the fact that the state might be able to is literally running out of money, the ability to say, listen, this isn't really going to happen on time, but you are optimistic.
I am, because we have to all understand that we have a priority here, and our residents of the entire state, our districts, are counting on us. Our hospitals, our schools, they want us to produce a budget, but a sound budget that's reasonable, that doesn't affect the most vulnerable communities, that being children and seniors. I think those are the two populations that we all want to protect. So it's really a matter of us as a house getting together and having the same objectives. So that's what we strive for.
All right, we're gonna bring you back in April if this doesn't work out. We're gonna bring you right back. But let me ask you about this. Overdevelopment is something that seems to be a major concern, particularly in the borough of the Bronx, and I know something that your district faces. But then also you have to deal with affordable housing as well. How are you able to deal with these challenges, and how do you foresee these things going on in your district?
That's also a challenge to deal with. Overdevelopment in terms of some of the different types of housing we have. We have a great need. We don't have a lot of vacant land available anymore in the city, in the Bronx. We have seen a resurgence of special needs housing. We have a number of, whether it's shelters for homeless families or those that suffer with a mental illness or some type of disability. What I always say and what I always talk about when I speak at meetings and talk to developers and not-for-profits is that we have to have a balance. And so with any type of development, you have to understand that children are still here, children are growing, and we always have to have some type of way to cater to everyone. So whether it's commercial, whether it's residential, it's schools, it's our playgrounds, we have to find some way to accommodate everyone's need, because no one's moving anytime soon. We hope they're not. And we just see an increase in our population that just continues to grow. So unless we try to adopt and find ways to meet that demand, we're always going to be at an imbalance.